Firstly, can I double check before Linda and me start? Is anyone really disappointed that coffee's not happening now? Or is anybody delighted that we're the kind of like the appetiser that'll make the coffee taste even better, and the biscuits, if there are any, even sweeter and crunchier? I'm Bruce Elliott from, I work for NHS Digital, but I'm with the Healthier Lancashire and South Cumbria team, helping to bring the Building a Digital Ready Workforce programme to life. So making certain that people throughout Lancashire and South Cumbria can make best use of some of the digital tools that we've been sharing this morning, that they've become a normal part of care. And
I'm Linda Vernon, so I work with Bruce in the digital team at Healthier Lancashire and South Cumbria, and I'm leading on the Empower the Person part of our digital strategy. And if any of you have you seen our digital strategy? healthierlsc.co.uk/digital future. There's lots of good stuff on there. But any of you who haven't seen the strategy, we've put Empower the Person at the centre, and everything that we do, whether that's supporting the front line, which is some of the work that Bruce is doing, or managing systems more effectively, integrating services, is all about how can we do that to empower our people. So really we're keeping our people at the heart and centre of everything.
And we'll try and explain as we go through this how it all links together, because the programme which I'm going to try and really enthuse and engage and hopefully get you to feel like pioneers, because you feel like pioneers at the moment in the digital world?
Yeah.
Oh, great, teacher, get a response there. So that's great. So hopefully at the end, you'll just sort of think that, you know, some of the things I've heard today, they're all about pioneering, just trying to make things work, make it the norm within a new area where it's never happened before. So hopefully we're going to capture that pioneering spirit. But there's no point in being a pioneer like me, a pioneer of trying to introduce Sunderland Football Club to the northwest and to Lancashire, because usually I get a zilch response. But when you're pioneering things which really make a difference to the patients and the people, and your other colleagues actually implementing it in Lancashire and South Cumbria, you can be a pioneer who can make a real difference. And it's all about trying to help you. So we'll skim through a lot of this, but we wanted to try a little bit of a quick overview of the digital strategy in Lancashire and South Cumbria that Linda mentioned, and how digital pioneers fit in. And the final bit is we want to make you feel eager and enthused to actually become a pioneer yourself, possibly, or to recommend to other people, you know, like Lisa, who, I don't know if Lisa's in the room now, Lisa Dre. Lisa seems great for developing an army of pioneers. You're always hearing about Lisa knows somebody who's doing a brilliant work here. And it's about that. You might be somebody who knows someone else who just needs that time and space to bring their ideas to life, which is what it's all about. So, Linda mentioned a bit about the programme, and I'll get her to do a little bit of a greatest hits about all it fits together, because it's centred on Empower the Person, but the main bit that the Digital Pioneers programme comes from, and that we're funding in Lancashire and South Cumbria, is called the Support the Frontline programme. So Health Education England, through their local Workforce Action Board, you needn't remember all these acronyms, they've helped to fund this aspect of the programme, which is about trying to make digital normal, to try and enthuse people, give them the opportunity to innovate across the workplace. So it makes a real difference in day-to-day practice. But as we mentioned earlier, that there are 5 different themes, and the Empower the Person one is what we're trying to drive everything to. And Linda's just going to give you a quick summary of some of the great hits in that area.
Yeah, well, we've been doing some work already. I've been in the team for just over a year, and we're doing a lot of engagement work really with our public, and a lot of that's through the third sector. And obviously things like, the Orb, I just get so excited when I watch that video and the music gets me going. I think, what an amazing thing we are offering our citizens. So I think between iPlato and the Orb, that's great, but we're also looking at Orca, trying to bring these things together. We're trying to look at how we can deliver social prescribing better, but really it's about how do we communicate the message to our public and our patients, but also the people who are providing health and care to those patients and public, about how we can actually change the way we do things and do things more in a more digital way. So we had some workshops a few weeks ago, some of you may have been at them, where we were trying to co-create with you guys, our stakeholders, our delivery plan for next year, 2019-20. And if any of you are available, we've got some spaces, I think, still for the codependencies workshop, which is really trying to pull the delivery plan for all the projects that you guys and your colleagues proposed that we should look at as a focus for 2019-20. That's on next Wednesday, and there are details on the Healthier LSC website if any of you want to come and help us to shape how we deliver care in the future digitally.
So ultimately, everything will help empower the person, but the Digital Pioneers programme, that might mean that you're somebody who knows somebody, or is somebody who's got an idea to help manage the system more effectively, that we can better integrate services so patients don't view the fact that there's a big block all around the system, or that you might have some idea, I'll refer to virtual reality later and artificial intelligence, but something round the corner, and you just want the headspace to create the future. So, why do we need pioneers? Well, if we just click on here, we just see that you've probably heard this a bit before, but this quote comes from the Topple Review, which is a review at the moment being carried out by Professor Eric Topple, American professor, who's big in the use of machine learning, artificial intelligence, and was asked by the Secretary of State for Health just to look at the best ways in which we can make certain that that becomes a normal part of undergraduate teaching for future healthcare professionals and for updating the skills of our current workforce. So the Topple Review is happening at the moment. It's going to be published, I think it's round about December time or early in the new year. And the prediction in there is Health Education England forecasts that if we fail to reduce demand and increase productivity, then we'll require at least 190,000 more staff by 2027. And somehow we don't think we can find 190,000 staff, or we can afford it. So this is where the digital component plays its key part. So in Lancashire, we have a resource of 86,000 people working across health and social care at the moment who are part of that resource. So rather than people thinking that I'm just one of those 4,867.19 whole part-time equivalent in primary care, is any one of the 0.19 their whole-time equivalent there today. But rather than just feeling one of those, you're one of 4,867.19 people who can educate and infuse other people into using digital to reduce the pressures on those services. So the Digital Pioneer Scheme applies to anybody working in health and social care.
Including those in the grey boxes, so the third sector and care homes and support staff are as important as the people who are in the system ourselves.
And even patients and volunteers in their own right who are actively involved, maybe in some of the PPG activities, that sort of side. So it's quite interesting when we look at the definition of a pioneer. And again, I've seen a few of these people within this, some of whom are in this room who fit some of these descriptions. A person who was among those who first enter or settle a region, then thus opening it for occupation and development by others. So I know there are some rural parts of the county and some distant parts of Lancashire and South Cumbria, but they're all fertile ground really for trying to develop new ideas, so we can lift things from Millham and make them work in other parts of the county and area. One who was first or among the earliest in any field of inquiry, enterprise or progress. There have been some developments, the use of virtual reality in Morecambe Bay, developed by Farhan. That's the first example I've come across in the country of virtual reality being used in the management of COPD or any real direct health conditions at scale. So we've got people who again fit that bill within this area. Or one of a group of foot soldiers detailed to make roads, dig entrenchments, etc. in advance of the main body. We see an awful lot of that, and that's really why I'm working in Lancashire and South Cumbria now, because through people like Linda and Stuart and others that I've come across in this area, you've got people who have been doing that digging and stretching, making other ideas work within the local area, and that it's ripe for kind of the main adoption and colonisation and testing about these ideas. So just clicking on a little bit, I'm just going to embarrass a few people. These are some of the pioneers that I see in my life that maybe you haven't, and one of them I feel very embarrassed with. We've got a George Dingle picture on there, and I've never come across George until today. But this was like searching for some of the kind of aspects of work within the area. You might see a Mia Hannan, who's a GP down in Hyde, and has certainly been one of the pioneers in practice in that area that I've learnt from around online access. And then a patient pioneer was Margaret Rickson, who was one of Harold Chipman's patients, and also one of Amir Hanan's patients. Margaret sadly died a number of years ago, but Margaret was a pioneer in terms of getting older people in the Hyde area interested in online access so that they could develop an understanding of the health condition and manage it.
Proving that patients are pioneers as well.
Yeah. Right. Now this might be the reality, whether or not you're a pioneer or not. This actually comes from something like, I'm from the northeast, and this came from something in my care. I'm a type 1 diabetic, and I'd been referred to North Tees Hospital. And this was a sheet that was given to me. And this is the reality still in care in lots of areas. So we're not saying that digital's got to be something brand new, spanking new and fancy, that you can only be a digital pioneer if you do that. In your organisation, you might see processes which involve passing hand-scribbled notes to patients with details of whether or not to fax with extra sheets to show how urgent this is, the referral or not. If you see systems like that, you can be just as pioneering as other people, really. So that's just an example of what still exists out there, and pioneers can do that. It's not all new, fancy, shiny stuff. But, yeah, I should have put this the other way round. But that was trying to show my mother-in-law there, because my mother-in-law, in terms of engaging within the family, it's about trying to think, you can be a pioneer by thinking with your own family and friends, what difference can that make? So how we try to judge whether or not you're a pioneer is you tend to to have a little bit of a tick in all these boxes. You might be passionate in your home life on advising your friends and family on how to use online devices and local community members. That's a big part of kind of like the work that Linda's doing as well, about how we can empower the person. But then at work with our colleagues there, we know how to get the best out of systems. And if we don't know the best out of systems, we maybe have some ideas and things about other places in the area or nationally that might to do that. So at work, in my home life, I still haven't fully mastered that one. In my work life, I know I don't get the best out of systems. But then sometimes I get so frustrated by the systems that you have to go through in your life. And so we want frustrated people who feel that there's a chance that they can apply a little innovation, a little improvement, and all they want is the headspace to be able to do that. And then they can articulate what difference that can actually make to improving the existing ways in which we work, and also maybe even look about how we can apply it within our own home lives. So, well, that's a final one of trying to look healthy and do that. Just applying it as much to public health as any aspect. So, the devil's always in the detail. And so, if you're interested or if you're thinking of any pioneers, the scheme, I've got a closing date on it. We've had a closing date, and we were just looking at the first applications yesterday.
Application forms are online on healthierlsc.co.uk/digital pioneers. I think it probably say there somewhere. We had a closing date for an initial round of applications that were also applying to the Innovation Agency's Coaching Academy. So they had a deadline, and that was offered as part of the package that we were offering anyone who wanted to avail of it. So the closing date for that bit has closed, but the actual Digital Pioneers programme is going to be a rolling programme for now. So that's still open to applicants. There's up to £1,000 startup fund available to people if there's stuff they need to buy. But I think as a clinician who has tried to innovate, and I know that there are other clinicians in the room who've tried to innovate, I think the most valuable bit, if I'd been a few years earlier and this had been available to me, would be the backfill, because it is really about headspace. We're really, really aware that it's time away from the front line doing your normal job, keeping up with pressures and meeting the frontline demands. That's the bit that's usually the biggest struggle when you're trying to innovate and do something slightly differently. So we've got up to a day, a week of backfill pay that we can support your service that you're leaving for a day to do this. And then we can hopefully provide lots of connections, lots of coaching and mentorship to help people to take their ideas from a few scribbles on paper, from a problem perhaps that they've got a half idea about a solution for, and they perhaps need our help to work that up. We can support them with that workup as well. So we had, with the first round of applications, we had 13 applicants within 6 weeks, so we were quite chuffed with that. We've had an initial look at those applicants already. It was wonderful because we saw names that we didn't recognise, which I think is great, because in this space it's often, the people like George and Stuart and those frontline clinicians who are really driving and pushing. They're the names we come across often, but we need to get the new blood in, and we need to get people who are on the front line with problems that they really are passionate about addressing. So we had some new people, we had some third sector as well as health, as well as care council staff. We had ideas that were about improving the way services are delivered to patients and the way patients access services, about how people are empowered to have more information. That's the public as well as patients. It's not just about the patients who are already in the system. We had some ideas around how staff could internally work their systems a little bit better. So we're really open. It's a very, very blank canvas as to what we will consider, as long as it will ultimately empower people, hopefully at scale across the system, to deliver services better to the patients that we serve. Was there anything else?
Well, I think the only final points with it is that it's not a bureaucratic process. So if you've got energy and enthusiasm and just don't quite know how to direct it at the moment, and so we're fine about that. It's about just having that idea and creating the headspace for you to take that forward and make it happen. And the other thing that I just say is the only real condition that we apply to it is it's a really non-bureaucratic process. In terms of looking at approving these, because we want to help. Innovators have often said they get frustrated with long drawn out application processes or presentations from me. So what we want to try and do is make it as easy as possible, and that's certainly been the case with the first wave, to actually get it stimulated. The only thing that we're going to ask is, through forums like this and other forums that we're creating, online forums, that you will share the development, you'll share the frustrations that you might have along the way and the problems that you have along the way, along with the successes with other people. So it's the benefit of the whole of Lancashire and South Cumbria.
And I think it's important to say as well that Bruce and Sue, who's leading on the programme as well, the project as well, are happy to have sort of inquiries and to maybe help people to sound out their ideas before actually filling in an application form. Because there's no deadlines, it's just, we'd rather have a conversation and get the ball rolling and support you to apply than for you to shy away and not do anything about it.
Yeah, so if you're worried, like the main inquiries so far, and I've learned so much from them that have come through, have been, is it all right if I put in an application around about this? And it seems to be that lots of people are asking for permission still for putting in applications when they've got some great ideas around patient education in the use of digital tools, and that sort of like. So, please just ask, or please just put it in. Don't worry about the response. If you've got a good idea, we've got so many good ones that have already flooded through in the first wave that I know it'll make a difference.
And I think what we've also talked about is that even if an application isn't successful, we will try our very best to signpost people to maybe other mechanisms of support, or if it doesn't really fit with the sort of wider picture, then we'll help them to shape it into something that perhaps fits better with the strategy that we're working on and the delivery plan we're working on at the moment. Okay? Are we done?
Yeah,
right. I wonder if I could invite Ross back up and then take any questions on the Orb and the Pioneer programme.
Yeah.
Is that okay?
Okay.
Has anybody got any questions about either?
Ross, are there certain services that will become available in the next 12 months that aren't currently available now?
Lots, yeah. I think the idea is we should limit any, really. Working with, for example, Orca or the NHS App Store or any other sort of means. It's all about getting all of these digital services available to people so they can add to their orb. You know, so it could be a diabetic sort of app to manage the diet or something like that. So yeah, no limitations really.
So, for example, if our patients download the orb and then they're already registered with iPlato and patient access,
Yeah.
will the patient have to keep logging in to each of those things, or will they all remember their login details, a bit like a digital passport?
So obviously the NHS have been working on their centralised ID, which is great. We spoke to them about that, and we're actually engaged with them now because although that's a really good idea, we think that actually we can enhance that by having a central platform. We can allow the incorporation of that screen, quite simply. So that you have one login, you're going to have to use it once. So if you could actually have that login at the front page, effectively, which you don't have any login on the org to start with, we don't ask for any information, there's no personal information, it's completely anonymous on our platform. But that doesn't mean the NHS can't add that ID screen in. Makes it really easy for a person, because we think that even having one login, having to put it in multiple times, will be an inconvenience. On the same note, it uses the technology that you already have on your mobile or your tablet. So if you're on a website and you put in a username and password and it says remember me, it will remember you. If you download an app and put your username and password in, you won't have to do it again, because you don't have to now, you know. So we're not reinventing anything there.
That kind of follows on to the question that I wanted to ask. So I've actually downloaded it on
Okay.
Saturday, and I've gone to book an appointment,
Yeah.
and it comes up with patient access.
Yeah,
Now,
yeah.
I'm hoping that that is because my GP practice don't yet have my GP.
Yeah.
Therefore, I can only use patient access, and therefore only have patient access installed on my phone.
Yeah.
If I had both apps, would it then offer me the option of which one I wanted to
It
use?
would, and we've discussed lots of different options. So what we had to do at the beginning was to work out what most people would have. So that's why we put patient access on there. But in theory, this is customisable to however the NHS or you want to configure it. So what we came up with, for example, is on that particular path that you're talking about, the GP path,
Yeah.
the first time that you press it, we said, why doesn't it come up with a screen? And so you select your GP. And if you select your GP, then it can automatically align which service is relevant to you.
Yeah.
It's really easy to do for us, but it's all about the NHS defining how they want it, not us, really, because we don't know the system as well.
And obviously there's compared with lots of great examples there, and it may come across as a little bit cynical, so I apologise.
No,
if
it's
it
okay,
does.
yeah.
But how closely are you all working together? Because I just think from sort of our patient perspective,
Yeah.
and I say, well, which one do you want me to use? It's all confusing. Why does that?
Yeah, yeah.
So can we be reassured that there's collaboration
Yeah.
between yourselves, between us, between iPlato?
So from our perspective, our platform's been built on collaboration. You know, it uses every other service that exists. So, you know, it's completely open door with us. Naturally, going through this process from coming from outside of the NHS, it was daunting first of all, but it's taken us 3 years to finally get to this point where people are engaging with us now throughout the system. And that means, you know, in reality, so we've got meetings scheduled with the ID people, centralised ID. We've got meeting schedules with the NHS app, so there was a bit of confusion. But in truth, the NHS app, to us, does something that some of the other providers already do. Just because it's got the NHS brand on it, for us it's just another path that a person would want to access and would be able to be incorporated into this org platform. So we don't have any competition at all. We think that we can enhance anything that exists because it will drive up the adoption and use of it, which we think is good.
Any other questions?
Yes.
Well, as a patient, I know nothing about any of this. I'll give you an example. Last week I got a text from my GP practice for a flu jab. Tried to ring them up, couldn't get through. Ended up going in the practice to make my appointment. When I go in, I see nothing of this whatsoever. So, as one of the now older generation, what is being done to let them know?
So just in terms of the orb side, the reason for that is it's still at a development stage.
So once, that, but there's a lot of others
yeah,
that are not.
so once it's launched, so we've got a comms plan around that. So we trialled the use of a team going out into supermarkets, went into Chorley Town Centre as well with the orb, with it on tablets, with other products like Orca and that, talking to residents around that. We're also doing, for those that are online, a lot of online marketing around that as well, so that you'll see it pop up at various points and then you can download it straight away. So we're trying to catch it, and you'll see from the way we've done a lot of the engagement, we're not all just assuming everybody's online. We're going out to groups. We've just done a session with some over 55s, and we're going to do some work with Age UK as well. We met Age UK last week, so they're going to do that. And I think as part, when it is launched and it's on the iOS store, Lancashire County Council have agreed to do all the engagement for the orb through all the libraries and things like that as well. So that's going to be available, sort of advertised in the libraries and things like that. And we've got a meeting which is scheduled in with Cumbria Council, Cumbria House Council as well, to do something similar.
And I would just add that you guys have, and we've been doing an awful lot of work that's been in bits. We've been reaching out to lots of little communities and specific groups and to individuals, people out doing their shopping. We've had vans out to talk to them. But one of the biggest themes that emerged when we had our co-production delivery plan workshops a couple of weeks ago for Empower the Person was, how do we better engage and communicate what we're doing? Because there's some fantastic stuff, as we've all seen today. But as a patient in my doctor's surgery, I know that there's no promotion of iPlato and there's no promotion of my GP, and I know that they have access to it. So we're very aware that in the 2019, 2020, actually marketing and getting out there in newspapers or media or bus shelter, billboards, whatever we need to do. There's been a recent obesity as a cause of cancer campaign. I've seen it so many times on bus shelters and billboards. So there's ways like that we know we have to think to reach the masses rather than just reaching smaller groups, which is how we've sort of been doing it so far.
I would reiterate again though, with group, gatherings like this, if you want us to come to your practices, then we can come and do that, and that's really what the purpose of this is, to show you early on this is coming, and we're in your hands really on what you would like us to do in your areas. It'll all help drive up your online figures anyway. So that's what the support is.
I'd just like to add a point. That it's the reason that we built the platform, really. So the fact that you don't know those things around, that's why we built it. Because once you have this platform, so the first thing we need to do is to get this out there. But once you download it, it's a place for any new service that becomes available for it to be easily communicated to you, because you already have the platform. So if a new service comes out that's relevant to you, you don't have to go through the process again of this huge communications plan that involves all the different mediums. You already have a platform. So in theory, what we spoke about with the NHS app, for example, even though it's the NHS and it's doing something that others have sort of done already, they're still going to need to go through the process of getting that communicated out to people so they download and use it. If we have this central place that people have, a digital place, effectively that's their own platform, it's been done already. Effectively, you could communicate that message out via Beam that I showed you earlier. Even the Orb Assist, so knowing how to use that service, that's another important point. We can market that to you and you download it, but then not know where to find the information on how to use it. Having a central place allows you to sort of funnel all of that information into one place.
I fully agree with you. It's that communication with the individual that's the crux of all this.
Yeah.
Because I think with that, on that point, because I'm a patient participation group member in the North East and a diabetes a patient champion for Diabetes UK, and I think with it I learned so much from that, because I work in the rarefied atmosphere where we're trying out all these new ideas, but I know even for busy practitioners, never mind patients, they have a problem getting the headspace, the time just to absorb it all and just see how can we make it relate to a patient. So we're really trying to work on that, and that's one of the big themes of like Linda's work, and so it knits together. It doesn't seem like it's in a separate box. It's something that you might mention as part of a consultation, or even prior to a consultation, about ways in which you can get involved. It's just a normal thing rather than a different thing.
We've also, Louise is at the back of the room, she's the comms lead for the digital team for Lancashire and South Cumbria. And we've been out with Health Watch, where we've been getting the public's views on what's the main sort of incentives and motivators for managing their health and well-being digitally, but probably more importantly, what are the barriers and the challenges? And often one of the biggest barriers is, I didn't know I could do that. I didn't know I could access my records online. That would be so helpful if I could. So we've been trying to find out what people don't know, so that we know what we need to empower them and the information we need to give them moving forward.
The biggest issue is the people who don't go into a GP surgery. That's
Yes.
the biggest one.
Yeah, and it's not an easy thing to crack. I mean, all the amount of money that's been spent on getting patients online, and it is, you know, we're still talking quite small percentages. So we're not under any illusion of that. I think because we can focus from a Lancashire and South Cumbria perspective, it will make it slightly easier. We're not doing a national programme like this, but again, I think we're trying to hit it from face to face with all the things Linda was talking about, but also some online marketing stuff in practice. But I think, as the point Ross makes, is it will be one place to go to access all the other services, whereas at the moment you're trying to offer all sorts of different services, and that's part of where the confusion comes. I could just take one last question, then we're going to break for coffee then. That's okay.
Everybody's been talking about keeping an individual's things in one place, but actually in the minority ethnic community that we have, it's very often one person that does everything for the whole family. Now, is there any way you can use the things that you're describing on one phone but for the family?
Are we talking about sort of
Like the org,
children or
Yes.
parent? So
parents or children
Yeah.
or basically related people,
Yeah.
but people who often, not all of them can actually read or understand English,
Yeah.
for instance. So they can't book their own appointments, they have to have somebody else do them.
So obviously lots of that would be nothing to do with us because we couldn't
No.
get involved. But you know, I think sort of to highlight the point, I was really intrigued with the Red Book. I've got 4 young kids, sort of all young as well. So I've seen the Red Book lots of times, and I always looked at it and thought, how inefficient is that? You know, I looked through it and thought it's useless to me. And my wife says, look at the chart. It's kind of, you know, but you know, thinking of the digital version of it, I think that's mind blowing. You know, the kind of information that will be available. And I heard something earlier in the presentation, which was about when that child gets old enough, will they take over sort of that record? And we went through a long thought process about actually how do you incorporate the Red Book onto a parent's board. So effectively you have, you know, a mother or father or both with all of their services on it, but then just a path that leads to that digital Red Book. So quite simply, it's linking just another digital service. It doesn't matter to us really, but you press that path, it brings up the Red Book. It's in one place. What you do then, you know, is down to the system and down to the people that are using it. So the fact that it's in there, the fact that it's being utilised by the person, the parent or guardian, you know, when that person gets to 13, 14 or 16, I think that, you know, the first digital person have a huge record, 16 years worth of information. It's about sort of empowering that person at that time. But I think in terms of bringing all of those things together, the platform could facilitate it, but there's naturally lots of things in around authority and around allowing, you know, people access. I don't know the ins and outs of that, but the platform could facilitate it because it just brings together digital services. I think someone else would need to answer in terms of how do you allow, you know, parents to access not just children but older people even. You know, I think someone that's 90 years old that you want to be able to see their appointment and do things for them. Why not? You know? Yeah. Great.
So if we could all break for coffee now for sort of between 5-10 minutes max, because we've still got sort of 2 or 3 presentations to do.